Assalamualaikum and hi to my beloved lecturer. My friend and I will present our assignment 2, which is the title that we have chosen, Phenylketonuria. I will start the presentation with an introduction. My group member is Anis, who will explain the symptoms. Continue with Nadira, who will discuss the genetic cause and how we can diagnose this disease by Aisha. And lastly, Damia, who will end our presentation with the management of the disease. Now, let's start our presentation. Phenylketonuria (PKU) is a rare inherited disorder that causes a build-up of phenylalanine, which is one of the amino acids. This condition happens because of a mutation in the PAH gene, which impairs the production of the enzyme phenylalanine hydroxylase (PAH). This enzyme is responsible for breaking down phenylalanine. When PAH is deficient, phenylalanine accumulates in the body, leading to toxic levels that can harm the brain and cause intellectual disabilities. If untreated, early diagnosis through newborn screening and managing phenylalanine levels through a specialized diet are essential to prevent complications. That's it for the introduction. Next, I will pass the presentation to Anis, who will explain the symptoms of this disease.
Now that we understand the basics of phenylketonuria (PKU), I, Anis Fatin Shahira binti Muhammad Nizam, will explain the symptoms of PKU in detail. So, as Zakira has explained previously, phenylketonuria or PKU is a rare genetic disorder that impacts the body ability to process phenylalanine, an amino acid found in protein. So, when this process fails, phenylalanine builds up in the body and lead to toxic effects. PKU is typically diagnosed at birth through newborn screening programs, but if left untreated, its symptoms can become severe. First off, let's start by looking at the symptoms of phenylketonuria (PKU) in infants and young children. Although babies with PKU are usually healthy at birth, symptoms can start to appear within the first few months of life. The key symptoms can include growth issues such as stunted or slow development, developmental delays including delayed speech or motor skills like sitting and walking, and if untreated, intellectual disabilities can occur, leading to severe learning challenges. Aside from that, neurological symptoms are also common, such as seizures or tremors. Additionally, they may also develop behavioral issues like hyperactivity, aggression, and mood swings. Skin conditions such as eczema are often observed in infants and young children with PKU. You might also notice lighter skin, hair, and eye color due to reduced melanin production. This lighter appearance is typically more noticeable in families with darker complexions. Another noticeable symptom is microcephaly, which is an abnormally small head size. They also have distinct musty odor in the breath, urine, or sweat caused by the phenylalanine buildup. Now, what happens if PKU is untreated or poorly managed in older children and adults? If not managed or treated properly, they are commonly reported with having psychiatric issues such as mood swings, anxiety, and depression. These individuals may also face behavioral and social challenges, including frequent temper tantrums or even episodes of self-harm. Memory and concentration issues are another concern, making it difficult for them to focus or retain information. Last but not least, untreated PKU can lead to neurological problems such as tremors or coordination difficulties. Fortunately, PKU is manageable with early diagnosis and proper treatment. Understanding the symptoms and the importance of early treatment is key to minimizing its impacts.
Thank you, Anis, for explaining the symptom of phenylketonuria or PKU. My name is Nadia Roslina binti Yusuf, and I will now discuss the genetic cause of PKU and how it leads to this symptom. Phenylketonuria is a disorder of phenylalanine metabolism caused by mutation in the PAH gene located on chromosome 12, making PKU an autosomal disorder. This gene provides instruction for making the enzyme phenylalanine hydroxylase, which is responsible for converting the amino acid phenylalanine into another amino acid tyrosine. Most PKU cases are inherited from parents who carry the mutated gene, although some can arise from spontaneous mutation in reproductive cell, These are germline mutations occurring in the gametes and can be passed on to the next generation. PKU is commonly caused by a missense mutation, where a single nucleotide substitution results in one amino acid being replaced by another in the enzyme. Another mutation, such as nonsense mutation, which create a premature stop codon or small insertion and deletion, can also lead to PKU. These genetic changes prevent the proper breakdown of phenylalanine, causing it to accumulate to toxic level in the body. This build-up affects the brain development, resulting in symptoms such as intellectual disability and developmental delays. Additionally, high phenylalanine level reduce melanin production, leading to lighter skin, hair, and eye color. When phenylalanine accumulate in the body, this can interfere with brain development, causing issues like smaller than average head size due to impaired brain growth, memory problem, concentration difficult, and inability to stay focused. Excess phenylalanine is broken down into another compound which are excreted through urine, sweat, and breath, give rise to characteristic musty smell associated with PKU. That's all from me. Now I will pass it to Aisha to discuss the diagnosis of phenylketonuria.
Right. Moving to the next point, my name is Aisha. I will explain regarding how to diagnose or what method we can use to detect phenylketonuria disease. The first diagnostic method is through non-invasive prenatal test. This test helps to detect PKU disease during the pregnancy. It usually done between 10 to 13 weeks of pregnancy, and the two main procedures are chorionic villus sampling (CVS) and amniocentesis. A small sample of placental tissue is taken which contain the same genetic material as the fetus. Move on to the next test, which is newborn screening process. This test is a crucial step for detecting PKU disease. It typically performed within the first 24 to 72 hours after birth. This to ensure that any potential issues are detected as early as possible. And then this procedure requires a collection of a few drops of blood from baby heel. A few drops will place on special filter paper and send it to the laboratory analysis. If the amount of phenylalanine is high in the blood, the results are positive. Further confirmation tests will be conducted to detect phenylketonuria disease. Alright, now let's move on to the genetic testing. The main purpose of genetic testing is to identify specific mutation that are responsible for this disease. This also allows suitable guide treatment for the patients. For example, DNA sequencing is one of the methods in genetics testing where the sample of blood or saliva will be taken and analyzed. The technician will look for mutation in the PAH gene, which known to cause phenylketonuria disease. Last but not least, the last test that I will explain is about urine testing. This test is not the primary method to detect phenylketonuria, but it can provide supplementary information in certain cases. This sample test will detect phenylpyruvate acid in the urine, which is a byproduct of elevated phenylalanine levels. One of the common tests used is ferric chloride test, where a chemical reagent is added into the urine, and the green color will indicate the positive result of the test. That's all from me. Thank you.
Before we move to the next point, which is the treatment of phenylketonuria, let me introduce myself first. My name is Nudame Izani binti Rizaimi. As Akira has explained, phenylketonuria is a genetic disorder that prevents the body from breaking down an amino acid called phenylalanine. A buildup of phenylalanine can cause intellectual disability, brain damage, and other problems. And phenylalanine is found in many foods. So, the main treatment for phenylketonuria is a low-protein diet, which means people with phenylketonuria must avoid high-protein food such as meat, fish, eggs, cheese, soya, and others. The amount of safe phenylalanine to consume differs for each person. Therefore, a person with phenylketonuria needs
Testing is to identify specific mutation that are responsible for this disease. This also allows suitable guide treatment for the patients. For example, DNA sequencing is one of the methods in genetics testing where the sample of blood or saliva will be taken and analyzed. The technician will look for mutation in the PAH gene, which known to cause phenylketonuria disease. Last but not least, the last test that I will explain is about urine testing. This test is not the primary method to detect phenylketonuria, but it can provide supplementary information in certain cases. This sample test will detect phenylpyruvate acid in the urine, which is a byproduct of elevated phenylalanine levels. One of the common tests used is ferric chloride test, where a chemical reagent is added into the urine and the green color will indicate the positive result of the test. That's all from me. Thank you.
Before we move to the next point, which is the treatment of phenylketonuria, let me introduce myself first. My name is Nurdame Izani binti Rizaimi. As Zakira has explained, phenylketonuria is a genetic disorder that prevents the body from breaking down an amino acid called phenylalanine. A buildup of phenylalanine can cause intellectual disability, brain damage, and other problems. And phenylalanine is found in many foods. So, the main treatment for phenylketonuria is a low-protein diet, which means people with phenylketonuria must avoid high-protein food such as meat, fish, eggs, cheese, soya, and others. The amount of safe phenylalanine to consume differs for each person. Therefore, a person with phenylketonuria needs help from a dietitian to create a detailed dietary plan for them. Phenylalanine levels are regularly monitored by collecting blood from a finger prick and sending it to a laboratory. If a person with phenylketonuria sticks with the diet plan and their phenylalanine levels stay within certain limits, they will remain well and their brain function should be unaffected. Other than that, people with phenylketonuria must avoid food products that contain aspartame as it is converted into phenylalanine in the body. Phenylalanine is an amino acid that people with phenylketonuria cannot process due to a genetic deficiency. Aspartame is a sweetener found in coffee, chewing gum, alcohol pops, and medicine, especially in children's cold and flu remedies. When people with phenylketonuria consume aspartame, the phenylalanine from the aspartame can build up in their blood, leading to serious health problems such as intellectual disability, seizures, and behavioral issues. Lastly, sapropterin and pegvaliase are used to treat phenylketonuria, but they work in different ways. Sapropterin is a medication taken orally to enhance the activity of the phenylalanine hydroxylase enzyme that helps to break down phenylalanine. Pegvaliase is an injectable medication that replaces the missing enzyme to break down phenylalanine. However, there is a study that claims that pegvaliase is more effective at lowering phenylalanine levels in blood.